Did you just have a knee injury or knee surgery? Are you finding it difficult to fully straighten your knee? Maybe you're walking or standing with a limp. So today we're going to dive into the biomechanics of knee extension, why it's so important to get that knee extension back, and techniques on how to get you there. Hey Rehab, welcome back to the channel. I'm Dr. Dorian St. Danik, physical therapist. Today we're going to explore the topic of knee extension mobility. But first, a disclaimer. Whether you're coming off an injury or surgery, make sure you consult with your medical team before trying any of these or any other new exercises. So let's start with the anatomy of the knee. Here I've got a right-sided knee, and the knee joint is comprised of basically three different areas: the femur or the thigh bone, the tibia or the shin bone, and then the patella or the kneecap. So together, these structures perform flexion and extension motion. So what looks and functions like a hinge does also have some other important mobility components. So this patella needs to slide superiorly or upward during extension to align itself in the groove of the femur. And the tibia, the shin bone, needs to internally rotate as we extend to better align its surfaces against the thigh bone or the femur. So after injury or knee surgery, inflammation, swelling, scar tissue development, muscle guarding, muscle inhibition, these are all reasons we may lose our knee extension. Moreover, we lose the mechanics of the knee joint. So this could be the knee joint itself, the tibia and the femur, the kneecap, the patella, or just the tibia itself, the shin bone. Lacking full knee extension can cause a multitude of kinetic chain issues. This includes standing with a limp, walking with a limp, underutilizing the quadriceps muscle during functional activities such as squatting or stairs. So the implications here is that we have increased microstress to the knee joint, and those issues that we talked about earlier, the inflammation, the swelling, the scarring, the guarding, the muscle disuse, all that can become amplified if you don't get after this, if you don't treat that knee extension mobility. So how do we know if we actually have full knee extension? Here are a couple simple tests you can perform at home or at the gym. So lie down on your back with your legs out in front of you. Elevate your Achilles cord on an elevated surface, such as a yoga block or foam roller. Take a photo of your knee joint from the side with the camera facing your unaffected side. Typically, you'll see the unaffected knee drop closer to the ground, while the affected side will be elevated higher. Another option is lying on your stomach with your shins hanging off the edge of a surface like a gym bench or a foam roller. And once again, snap a photo of your knees from the angle of the unaffected side. And here you'll see the unaffected shin should sit lower than the affected side. So these two tests are objective ways to assess and reassess your progress as you're working on your knee extension mobility. And ultimately, you want to reach symmetrical motion on both sides. So before we dive into the exercises, we want to discuss on how we can actually create significant and sustained mobility changes. So remember this phrase: low load, long duration. Research has shown us that joints respond well to frequent and consistent bouts of comfortable stretching. And so how do we define comfortable? Well, it's going to be a tolerable discomfort in a stretch that feels impactful, but you can still tolerate it for 10 minutes, right? So if you're tapping out at 3 minutes or 2 minutes, the intensity is just too high. Similarly, if you're stretching for 30 minutes without much sensation, the intensity is too low. Aim for those 10-minute bouts 3 to 6 times per day. Next, let's head out to the gym to cover our exercises. All right, so before we dive into knee extension stretching, we want to restore normal knee joint mechanics. So if we remember back to what the patella does, the kneecap, it needs to glide superior or upward, towards the face in order to help us get that full knee extension. You want to start in a position. These are patellar mobilizations. These are superior glides of the patella. So you want to start in this position where the leg is relaxed and out in front of you. You're going to hook 2 or 3 fingers right underneath the kneecap, and then just kind of start pushing that kneecap up towards the body, towards the head. And you really don't need a whole lot of pressure here. If you can imagine like a rubber ducky in a bathtub, like you're just giving it a little bit of a push, just something to see that kneecap move upward, up the thigh, up towards the face. You can do this 20 to 30 times. You may not feel a whole lot. You might feel the pressure of your fingers, kind of where you're pushing, but you might not feel a whole lot of stretch per se. It's a very small amount of movement. Just make sure that you're not pushing with too much pressure and that you're kind of digging into the bone and causing some discomfort, this should be pretty well tolerated. And this is just to start to improve some of those kneecap mechanics. That's going to then help us allow us to get that full knee stretch once we actually start stretching into knee extension. And so for the next exercise, these are going to be tibial mobilizations. So if you remember back, we need internal rotation of the tibia in order to improve our knee joint mechanics and get back to that full knee extension mobility. So for this one, we're going to take a seated position. Ideally, you take a foam roller or a yoga block in between the thighs on the lower part of the thighs. From here, you're going to lift your toes up to the ceiling, and then you're going to start to turn your foot, ankle, and shin inward towards the midline of the body, back outward, toes down to relax. When you lift up, you rotate in. You want to hold for about 3 seconds. You may feel some stress or strain or some work in and around the shins, maybe on this outer shin. Otherwise, very, very subtle, and typically only about 10-15 degrees of motion is going to be seen at the foot and at the ankle. For this one, make sure you're not tipping your torso or turning your thigh and your hip inward. This needs to be done at the shin, so you're getting true tibial mobility. Let's say you don't have a foam roller or a yoga block, you can just grab onto the thigh and go ahead and twist, just making sure that the thigh doesn't dive inward as you twist the shin inward. If you don't have this much knee flexion, you can also perform this with a little bit of less knee flexion, maybe 30 degrees, maybe 45, but it's a little bit easier to get better mobility and more mobility if you're at about that 90-degree angle. Go ahead and try about 20 to 30 of these. And both with the patellar mobilizations and the tibial mobilizations, you can do these 2 to 3 times a day. All right, so after we've got our patellar joint mechanics right, after we've got our tibial joint mechanics right, now we want to actually start doing knee extension stretching. So for this one, grab something you can elevate your leg onto. Maybe it's a yoga block, maybe it's a foam roller. You're going to sit with your leg out in front of you with the heel or even the Achilles elevated on the yoga block. From here, gravity is starting to create the stretch. So we're starting to feel some tension and stretch on the back of the knee, maybe back of the calf, back of the thigh. And that's pretty much it. Like, this is a relaxed position. The art here is finding that 10-minute tolerance, right? So we want to feel like there's some work, there's some significant stretch happening, but we can tolerate this for 10 minutes. We're not tapping out too early, and we're not staying here for 20 or 30 minutes. Let's say the stretch is far too intense and you're tapping out before the 10 minutes. Just go ahead and take that object and just slide it back. Maybe it's at the lower part of your calf now. Maybe it's even mid-belly of the calf. And now you just have a little bit less influence from gravity to create that stretch. And once you've kind of got your tolerance improved here, that's when you want to slide that yoga block away again until it gets to the heel. And pretty much once you're tolerating 3 rounds, 3 times a day of 10 minutes, you're gonna wanna progress into bag hangs. All right, so after we've built up some pretty good tolerance to the heel prop stretch, now we're gonna go into bag hangs. So when we say bag hangs, we mean a bag that's maybe a tote bag. You have a handle on one side, a handle on the other side, something where the bag is gonna hang underneath the knee. I'm actually gonna use a power band here, so kind of like a thicker mobility band. And I've got a kettlebell attached to the bottom of the power band. Typically, you're only gonna need about 5, 10, 15, probably no more than 20 pounds of weight in this bag hang position. Taking one strap above the kneecap, the other below. Make sure you are high enough, tall enough in your chair so that when you prop your leg on a table or another chair, you actually have the weight hanging and not touching the ground. And typically a bag is gonna hang a little bit higher, so it shouldn't be too difficult to have that bag hanging. If you don't have weights, you don't have kettlebell, just go ahead and take water bottles, can of soup, can of beans, that sort of thing, and just go ahead and pack those in. Those are about 1 pound each. Go ahead and pack those into the bag and start to see, okay, once again, what is my 10-minute tolerance here? So if I can get 5 pounds in the bag and I can go 10 minutes and it's no big deal, I should try to bump up that weight maybe to 10 pounds and see if I'm starting to get that tolerance around 10 minutes. So once again, stretch back of the knee, back of the calf, back of the thigh. Ideally going through the series of the heel prop, some of those patellar and tibial mobilizations. The knee should feel pretty good in the front and all the work and tension should be in the back. Once again, 10 minutes at a time, and then find that 3 to 6 time per day flow for this bag hang exercise. All right, so once we're tolerating those 10 minutes of the bag hang stretch, we need to start teaching the quadriceps how to control that terminal knee extension, right? So we're typically in hyperextension when we're here. We've done our 10 minutes. We're tolerating that 10 minutes, but we can do it multiple times a day comfortably and consistently. Now we want to add these quad activations, these quad sets. Taking a stretch strap, maybe a towel, just something you can hook to the bottom third of the foot. You're going to take the strap into your hands, and that strap is basically going to let you pivot and flex your foot towards you, creating a further posterior chain, backside body stretch. So this is really going to intensify the calf, back of the knee, and the hamstring. You're going to flex the foot, and then you're going to squeeze the quad. Squeeze the quad like you're trying to push the thigh down towards the ground. You're going to start to feel the quad working and probably a little bit more intense stretching as well. Start with 10-second holds, work your way up to 20-second holds, work your way up to 30-second holds. For this one, maybe you're doing 10 by 10 seconds. Maybe you're trying 3 to 5 rounds of 30 seconds. And this can come after you've kind of done your 10 minutes or so of stretching. Go ahead and do these active quad sets, these active knee extensions. And goal here is you just want to feel that quad working in this position. It's going to be more challenging to start having it access that new mobility, but you also want to keep your mobility, right? You want to keep this actual range of motion that you just got. So you got to get your muscles strong. You got to get your muscles on in this position. So make sure once you've tolerated stretching, you're actually loading it up with some active mobility. All right, so we've improved our knee extension mechanics. We've improved our knee extension mobility. We've started to activate the quadriceps in that terminal knee extension position. Now we want to load the quadriceps even more in more of these functional positions. So think of positions and movements like standing and walking and squatting and stairs. So let's dive into our first one. It's called the prone TKE, or the prone terminal knee extension. You're going to want to get on your stomach, lying flat, legs out straight behind you. And here's a trick. You're really going to want to try to grip the ground underneath you with your toes, so you can kind of flex that foot underneath you. And now you have some friction underneath the toes to basically make it easier for you to lift your knee up to the ceiling. That's my quad squeeze, terminal knee extension, followed by a relaxation and knee bend. And then you use the grip of the toes again to lift up. Hold, 10, working up to 20 and 30-second holds, coming off to relax. Typically, you're not gonna feel as much stretch on the back of the knee here, but you are gonna feel your quad working, right? So front of the thigh, engaged, burning, holding, maybe some fatigue. Might feel the glute a little bit as well, but most of this should be in the quad. Just one thing to look out for, try not to let those toes slip, because if you're doing it with less than ideal friction, like you're not getting a lot of friction out of the toes, the squeeze just won't be as strong, and it's not going to put that weight-bearing stimulus into the leg. It's going to kind of be offloaded, so you're going to be missing out on some of the advantages here. So go ahead and perform these guys, maybe 10 times 10 seconds, maybe 5 rounds of 30 seconds, and these you can do 1 to 2 times per day. All right, so we started to load our terminal knee extension with some weight bearing, trying to get the quad a little bit stronger. Now we're gonna weight bear a little bit more, and we're gonna add in more stretch to the posterior chain, the back of the body. So we're gonna get into our downward dog position. Hands up out in front of you, feet behind the hips. And then you're gonna start to raise the hips to the ceiling. And from here, remember that friction we want through the toes? Drive the toes into the ground and then start to straighten your knee, lock it out, squeeze the quad, hold, and then slowly relax. So this one's a little bit different. You're typically gonna feel like you're putting more weight into the leg that you're trying to work. So there's gonna be maybe a little bit more pressure that you might feel, and you actually might get a stronger quad activation in this way as well. You're also stretching your posterior chain, everything from the low back to the glute to the hamstring to the calf. So you're really loading that quadriceps in a fully stretched position. Go ahead and try 10 to 30 seconds here. If you're doing 10 seconds, maybe you're doing 10 reps. If you're doing 30 seconds, maybe you're doing 5 reps. And you can try this one 1 to 2 times a day. We're doing a little bit more weight bearing here, trying to get that quadriceps to work in the terminal knee extension position. All right, so once we've done our lying exercises, we've done our sort of partial weight bearing TKEs, we wanna move on into full weight bearing or standing TKEs. These are 3-way banded TKEs. Probably gonna wanna take a towel to take up some of the friction of the band that you're gonna be using. The band's gonna go behind the knee joint, and then that towel is gonna go in between your skin and the band itself. So 3 ways. First way, less weight bearing, affected leg in front, unaffected leg in back. You're gonna start in a knee bend, the foot is flat, and then you're gonna extend your knee, straighten your knee, and then start to lift the toes up. And this one we're not holding quite as long since we're going for repetitions here. And we're feeling our quad work, but we're being mindful of what our foot position is like, right? So when we think about gait or walking patterns, this is your initial contact. This is your first piece of touchdown when you're doing your walking cycle. So knowing that, hey, I gotta get my knee fully straight when I hit my heel to the ground, this is gonna help reinforce normal walking mechanics. So maybe you do 10, 15, 20 repetitions with the affected leg in front. You transition for more weight bearing by doing a foot side by side banded knee extension. Now the difference here is maybe this is more my mid stance phase. I've gone from initial to more mid stance, so my foot is starting to come flat. But really the progression here is a little bit more weight bearing as you're doing these TKEs, 10, 15, 20 reps. And then finally, I got my toe off position. As I toe off to push myself forward in gait, I now have the left foot behind me, and I'm working through what is basically a little bit more weight bearing if I can shift my weight back, and I'm working through that terminal knee extension, but I'm kind of going from a toe support to that knee extension, keeping weight on my toes, and then coming off into knee flexion, but still keeping weight on the toes. 10, 15, 20 reps. 1 to 2 times a day for the 3-way banded TKEs. All right, so putting it all together, we've done our standing TKEs at the wall, we've done our 3-way TKE with the band. Now you want to integrate it into the functional movement of, let's say, walking, right? So those patterns we talked about, initial contact, mid-stance phase, toe-off phase, you're gonna do what's called gait rocking. So you're gonna roll from heel to the big toe, pressure in the big toe, and then you go from big toe back to the heel. And what's important here is when you're weight bearing on the heel, the knee is fully straight. As the foot comes flat, the knee unlocks, it stays unlocked. And then as you get back to your heel, you lock out your knee into full extension again. You'll probably feel some pressure and some stretch on the phase where you rock backwards, right? Because your whole body weight is kind of going up and over and encouraging a little bit more knee extension stretch as you go back. Whereas rocking forward might feel a little bit more mellow and not quite as intense. This is a great exercise to do if you've been sitting for a while. Maybe it's first thing in the morning, you're just coming off the couch, that sort of thing. It's a great way to reset normal walking mechanics. Get a quick stretch in, get a quick quad warm up in. Do about 15 to 25 of these, really like as needed, or even after you've done your whole cycle of stretching and activation through your quadriceps. All right, so if you've enjoyed some of these exercises and techniques, feel like they might be valuable, if you want to see some progressions or modifications around knee extension, go ahead and check out our knee extension mobility program. All right, so to summarize, the knee joint is a hinged joint, but it does have influence from patellar gliding and tibial rotation. So use those patellar mobilizations and tibial mobilizations to restore normal knee joint mechanics. Use low load and long duration heel prop and bag hangs to improve the mobility of the knee joint, as well as begin to activate the quadriceps in that fully extended position. Finally, use your lying TKEs, your standing TKEs, and your gait rocking to improve the functional use and strength of the knee extension motion. Until next time, thank you, Prehab.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.